What's up, everybody? Welcome to the Better You Project. And today I have a special guest. I have Dr. Jared Pelo. He is the Chief Medical Officer and co-founder of Bionic Health. Dr. Pelo trained and worked in the emergency department before founding iScribes, an early ambient AI health tech company now owned by Microsoft. He started Bionic Health after a family tragedy and being inspired by the power of AI in medicine. Passionate about AI in medicine, preventative medicine, as well as muscle-centric health. Dr. Pelo advocates using advanced testing, AI tools, and is compassionate to enhance patient care. Welcome to the podcast. Let's start off by talk a little bit about your company.
Yeah, Lexi, thanks so much for having me. I'm excited to talk to your audience, talk to you about this, excited to learn from you. So a few things happened. As you stated, like I started in the ER and I was telling you, I got tired of fishing people out of the river or seeing them after they were broken. So they came in, they had their heart attack with me. I diagnosed them with advanced cancer. They had out of control diabetes. Like it was too late mostly for me to do anything other than put a patch on it, have them follow up with their primary care doctor. So that's one piece of the story. Another piece is about 2 years ago, the family tragedy was my brother-in-law, who was one of my best friends. He married into the family when I was 10. And so he was kind of like an older brother to me. And he was on a bike ride. He was an avid mountain biker, competed, and he had a heart attack and he died. And he was 62 years old. Looking at him, you never would have thought this guy's going to have a heart attack. And what I realized is he didn't understand his data. He didn't understand his risk. His doctor didn't understand his risk. And so unfortunately we lost him. So that was kind of one thing that happened. The next thing that happened was I was working at Microsoft. And one cool thing about working there was I was getting access to these AI models before the rest of the world. So it was kind of like mind blowing. Before ChatGPT was seen by the rest of the world, I was playing with models that were even more advanced than ChatGPT. And I just thought, man, there's such a need for kind of personalized precision medicine for people. And it's so hard to scale it because it takes a lot of time from really good clinicians to take care of their patients. And so I saw this opportunity, like, let's build something that we think can be more scalable over time. And so we started building Bionic Health about 1.5 years ago. And the way that we've thought about it is first we will build something that we think works. So instead of going out to a clinic that already exists and saying, what do you need? We want to build the tools for you. We decided to start our own clinic, provide the healthcare and the technology ourselves. So we built our own EHR. We built our own chat app for our members. We built like all the tools that we needed and started automating and putting AI behind all of that so that we could learn, so that eventually someday, like, we want to be able to share this tool with other providers so that they can kind of have the cutting edge, like, how do I take care of my patients easier, better, spend more time on what matters, less time on what doesn't.
Yeah, absolutely. Absolutely. Also, as a practitioner, in a very busy integrative medicine practice, I can't tell you some of the biggest pain points, especially in all the things that we do, is the documentation, the, transcribing of notes, reviewing labs, making sure that the turnaround time, in our model, we don't take insurance. So you're getting a bit of that concierge style medicine. And so the turnaround time needs to be efficient and needs to be effective. And so what better way to do that than with utilizing AI? What, I guess, in your background, what would you say are the biggest pain points where AI has really been eye-opening for you, from going basically from the ER to kind of what you do now?
Yeah. Well, so I'll give you a little background on my first company. So my first company, I'm driving to the emergency department. I was working an hour away from my house. And at our home emergency department, which was closer to my home, we had scribes. So we had people who would follow me around, write my notes for me, like life was great. And I was driving an hour to this other where I was a medical director. And I was just thinking, like, there's got to be a way for me to like take the scribe with me in my pocket. And so around that same time, Google Glass came out, which was, I don't know if you remember, it's super dorky, like technology where you looked like a cyborg and you wore these weird glasses. And I was like, well, if I wore those in the ER, then my scribe back in Lynchburg, Virginia could go ahead and do all my work for me. So that was kind of the first idea was, can I send my data somewhere else and have somebody else do the work? And then when we started building it, of course, doctors didn't want to wear these funky devices. Nurse practitioners didn't want to wear them. Nobody wanted to wear them. And so we started recording just using iPhones and recording the conversation between doctors and patients. And the way that I kind of think about it is you have to get data into the electronic health record one way or another. So you can ask your nurse to do it. You can do it. You can ask your MA to do it. You can ask the patient to do it. And there's trade-offs for all of those things. But to me, the most efficient way to do that is have a conversation with the patient and capture the data that you need, and then have AI help you either interpret that data into something useful. So take that conversation and interpret it into a note or interpret it into clinical decision. And the more data you can give the AI, so the more you can give it the medical history, the wearable data, like everything, then the AI can make smarter decisions for you and help you even more.
Yeah. No, I think that's fascinating. In some of the tools that your company offers, is that part of what is in the AI process for you guys?
Yes, absolutely. And so I'll talk a little bit about the product I used to work on, which I think is an amazing product. And really, since Bionic Health doesn't have a product that's available in the market for other practitioners, but I think for any practitioner out there, Dragon Ambient Experience is an amazing product. Like it's, they're partnershipped with OpenAI, so they're always going to have like the top AI model. It's super easy. It integrates with Dragon. So if you want to do straight voice dictation or you want to do ambient recording of doctor-patient conversation and writing your notes, like it's hands down kind of the leader of the technology out there. So I think it's an amazing tool. Places where I want to see it grow, like I'd love to see more of like a patient engagement, like front end capturing of data, allowing the patient to kind of give us data as they come into the visit. And then even the communication between you and your patient. So if you use a patient portal, if you use a chat app, if you use something like that, like wouldn't it be great if there was an AI that was looking at all their medical records and all the pharmacy stuff and kind of teeing answers up for you and letting you make that system faster and better. So, the way people talk about it often is like a co-pilot, like this clinical co-pilot. And I think there's a lot of work that's happening in that space right now that's super exciting to think about. Like, how can I spend more time like connecting with my patient and focusing on delivering great care and not as much time working on the administrative stuff that isn't fun and doesn't drive a lot of value to the patient anyways. Yeah.
Can you help me understand the differentiation between the like Dragon AI and like a freed AI?
Yeah, totally. So there's a lot of competitors to Dragon Ambient Experience or Dragon AI. And so there's like Freed, there's Nabla, there's Abridge, there's all of these.
Scribe. I think it's Scribe. Yeah.
Scribe. And the funny thing is, like 3 years ago when I was working on the problem, nobody had the solution except us. Like, because we had captured millions of doctor conversations and notes. And then GPT-4 came out and people could build other solutions that look fairly similar. So I would say the biggest difference between kind of all the competitors that are built on top of GPT-4 and then what Microsoft and Nuance has built is kind of the clinical accuracy. And then to me, it's like the bet on the future. Like how good is Freed today? It's pretty good. And it may do some of what I need, but how much is it going to like integrate into my EHR and do all those other things, tee up orders for me, like make my life easier in the future? So, and there's big price differences between all of these. And so as a clinician, you just kind of have to make your decision. Where am I going to spend my dollars and where am I going to invest?
Yeah.
But I think when I look at the competition, I love actually all the competition, because I think anybody that's going to work to make our lives easier, I love that. But I think it's pretty clear that that one Dragon Ambient experience is by far the best solution kind of out there.
Interesting. Some of the other things that I think is really interesting with utilizing AI is that, so again, going back to the type of medicine that I practice is integrative medicine. And so a lot of times we're finding new ways to do, utilize old resources and using it again. Well, what's difficult, especially is that, unfortunately, pharma pays for a lot of the research, right?
Yeah.
And so what better way to take data that we as the clinicians are doing, that it's, unbiased and that we're not being paid by anyone to do it, and then utilizing AI to critically kind of look through it and see pattern recognition to determine if X intervention happened, these were all the downstream effects as evidenced by so many cases with this, and utilizing AI can kind of pull out those keywords and that data to really kind of layer that on, that data is evidence. Which I think is such a cool thing in the peptide world that I work in, and the IV world that I work in, and the hormone world that I work in that we are like the researchers. And I think AI is going to be such a crucial piece of that down the road, which is so cool. As far as with the product that your company is working on, where do you see that going? Are you take it to market and then let's get it going, and then would you then have so let me ask you this. If a practice, let's say, had an EMR system and they've been using this EMR for 5 years, to incorporate such a product as what Bionic is making, would they have to then change their EMR completely to that for it to work?
Yeah. I mean, so what we're building today is we have the clinic and the technology. And I imagine what we'll do over the next 5 years is one of two things. We'll either hire local nurse practitioners, physicians as we spread across the US to kind of work inside our clinic system, or we'll kind of franchise. And we'll continue to build out the Bionic brand. I don't know. There is a possibility that we become kind of like a complete software solution. Up to this point, because it is so tightly integrated, the type of medicine we provide, as well as the technology, there's not a great way to disentangle those things. Because it's really somebody comes on board, they use our app, it takes them step by step through what they need to do to kind of optimize their heart health or to start working out and those kinds of things.
Yeah. Oh, absolutely. Okay, so moving on to kind of some other things. We talked about charting. We talked about clinical decision making. The other thing that I think is kind of interesting about AI is improving the accuracy of what we're doing. So again, as someone who uses AI, I can't tell you how nice it is that my staff can come behind me after a conversation I had with a patient, and they can see oh yeah, it looks like they did talk about this, and this was the dose that Lexi had mentioned, or this was the peptide she had recommended, and it was able to help nail that down. So this way it improves not only accuracy, but the time efficiency, and that they don't have to then send me my staff don't have to and verify what was it that you talked about. So I think that is going to be very big for a lot of practitioners who, just move. So I think that's great. I think that's really, really cool. As far as if someone was a practitioner and AI is new to them, they'd never heard of chat, they've never heard of bar, they've never heard of any of it. Where would you, as coming from a physician role, where would you say is a good place to start learning about this?
I would kind of point to two solutions. One, use a chatbot. Go try out Bard, Gemini, ChatGPT. Try them out. Microsoft Copilot. Play with them. Try to understand where they work well, where they fail, because they're not accurate, right, all the time.
Right.
And then number two, I would find a solution to a pain point. So kind of like we already talked about, documentation is a specific pain point that we can solve with AI today. And then what is that next pain point? Is it intake for your member. It might even be marketing. It might be like, I think you can find different pain points that you want to solve for, and you can almost always apply AI to solve for those problems today. So that's kind of how I would think about it. The other cool thing, like one thing I love that you mentioned was you're having this conversation, you're recording it with your patients, and then your staff can look at it. The other thing I love to do is, and maybe you're doing this, is I share that recording with the patient. And so they can search it and they can say, what did Lexi say? What did Dr. Pelo say? And they even share it a lot with like their loved ones. Like they go home and my wife's asking me like, what did the doctor say? And I'm like, oh, well, look right here. Let's listen to it together. And so I think there's lots of cool ways to kind of expand the footprint of what we're doing with AI. But yeah, if I were going to tell somebody where to start, I would like play with AI and then find a solution that's going to fix a pain point for you.
Yeah, no, it's great. I think the other thing from the clinical side, I think that's kind of neat with AI is, so we've talked about ChatGPT, we've talked about Bard. There are some great research tools that I think is so helpful in that, we're consuming information all day, every day, whether you're looking at your phone, I call it like it's TiVo, but for Google scholars, and that like, I've got a couple like keywords. I'm like, every day I'm like, I read 3 new articles a day, and that's why I'm like always staying up to date. Yep. But what's so hard is this information is coming at you all the time. I really, and I don't know if you've gotten to use it yet, or maybe you use it all the time, like Open Evidence. Have you ever used that program? I really like Open Evidence. When I talk to practitioners in our academy, I'm like, it's kind of like having your own RA, like your own research assistant, and you can kind of set it to things, which I think is great. I think the other thing from a research perspective that I think is helpful is you can take certain pieces of a study in that you're really trying to see like, okay, what is it that they're trying to study? And you can plug that into a ChatGPT and you can say like, summarize this in, a 6th grade reading level so I can really understand it, or, totally. Summarize the data. So I think it's helping you digest pieces of information so you can really kind of understand like, what is it that's being said here instead of just reading the abstract. Because I think 100%. That's far, far better. Another one that I was going to add, we talked about Open Evidence, we talked about Chat, Bard. What would you say is like, in your experience, like the biggest pitfalls or like the down thing? We talked about like hallucinations with some of these products. Like what would you say, like in your experience, has been like, didn't really work out the way I wanted it?
I mean, the biggest thing is inaccuracies. Another tool that I really like is Consensus. I don't know if you use that. Consensus.app is a really good kind of summarizer of papers.
Okay.
The funny thing was playing with these models early on. It was pretty easy to find where hallucinations, or some people just call them confabulations or just lies. And the funny thing is humans do this, right? Like like we make things up. And even sometimes when we're highly accurate and we're expert, there might be times where we slightly misquote a statistic or something. But I think that is the most dangerous part. The second to that, and this is something that I've thought about a lot for years and years, is as the AI model gets better and better, how do you make sure that a doctor actually pays attention and doesn't just sign off every time?
Right.
Or a nurse practitioner pays attention? Because you want to make it as close to 100% accurate as possible. But you need that person to actually take the time to make sure. And it's kind of like self-driving. Like, if you've ever driven a Tesla and you're like, this is pretty good, and like 95% of the time, it's not going to kill me, but 5% of the time, it's going to kill me. And I'd say self-driving is actually still bad enough that I pay more attention. Then sometimes the AI is like so good that it kind of can lull you to sleep. And so I think that's the most important thing for a physician, at least for the next few years, is if you're using AI tools, just make sure you pay attention. And it might just be the most important part. So like if you're doing notes It's, is the dose correct of what I said? Is like the medical history? Am I going to mess anything up in this medical record? Like, it's really just the most important stuff. If it was like they went to their grandma's house on Wednesday versus Thursday, that doesn't really matter.
Right.
It's really kind of the clinical facts that are most important.
And I think not only that, again, in our type of practice, in that we're doing so many like things that are not typical, like we'll say, tirzepatide or, lorazepatide or BPC 157. And it's like, wait, what was that? What was that? What's kind of neat, though, it does learn. So if you edit it in the AI model, it will that's how you spell it, The other thing with that, I was going to say, if a clinician is listening to it, and you're utilizing it to help you with research or to help, create an SOP or a protocol, you as the practitioner have to know enough about the subject matter to know if it's bullshit or not. That's the thing with that first my introduction to this was about a year and a half ago, and my husband loved all into the AI stuff. He said, sit down. I need you to ask it questions that you would know the answer to. And so it was like, tell me what were the 3 flaws in the 2002 WH study about hormones. Yeah. And it was like, and he's like, is that right? And I'm like, yeah, got it pretty close. And then I was like, okay, in what year did the rebuttal of that study came out? And it actually got that part wrong. But this was, again, like almost 2 years ago. And I feel like as every advancement happens, it gets better and better. But you still have to do your due diligence in knowing enough about the subject matter to know that's right or that's wrong or whatever.
No, exactly. That's why you need people like you who are trained to actually do it. It's not like we can lower the training level for the people that are providing care and say, okay, now this AI model along with, this medical assistant is going to take care of you. You still need that expert to guide it.
Yes. Do you think it will utilizing AI, do you think that'll strengthen or weaken the relationship with patients?
I sure hope that it strengthens it. I really hope, it's funny because there's been these studies that have come out that show that patients actually like the response from the AI better than the human. Now, partly I'm like, that's because humans are in such a hurry, especially in typical healthcare. Right? I'm sure, with your patients, you take time, you have the luxury because you built it to not work in kind of the mousetrap model of medicine. But regular clinicians, they're just trying to survive. And so I think in that case, for sure, AI is going to help there. But for people like you and I who are spending a lot of time with our patients anyways, I think it's a matter of kind of like you're already using tools. How does it make it so that I can look at you and I don't have to worry about documentation? How does it make it so that I can spend more time on patient care and less time on administrative work? That's really where I think it's going to be the biggest add for now.
Yeah, no, I absolutely agree with that. Is there any concern? Only because I was with one of my mentors about a week ago, and she's a little bit older than I am, and so of course I go in there and I'm like, "Let me show you," and I'm and she's like, "Are you?" She asked a good question. She says, "Are you at all worried about where that data, what you're plugging in, is going?" It's always something to consider for sure. What are your thoughts on that?
Absolutely. I mean, so. If we're going to put patient data into it, we definitely need to make sure that it's HIPAA compliant, whatever the model is that we're using. And if I'm using it for fun, I'm not as worried. If I'm using it to write a love poem to my wife because I'm too lazy to write those myself anymore, then I'm not too worried about it. But if I'm using patient data, if it's helping with clinical decision support, for sure, I want to make sure that, because, to be honest, I think a lot of our kind of colleagues actually are jumping on ChatGPT, and just putting patient stuff in there and then extracting it, putting it in the EHR. And I think that's really dangerous. I think
super dangerous. Yeah.
Yeah, it's not worth it.
There'd have to be some sort of interface where it could scrub the PHI out of it and then just have raw data. in there. So, yeah, no, it was something. And, I was talking to her about it. I'm like, well, like I was showing her how to utilize it. We were trying to create an SOP for her like gut protocol. And so she's like, I've got all these notes. I'm like, perfect. Okay, let's just start. And so, and she's like, but what happens to that data? I'm like, well, it's organizing it for you, and it's making the flow sound more in line with like a protocol. And that was her question. It's like, well, where does it go? And I'm like, I don't really know where it goes. It goes in the robot. I don't know.
Yeah. Well, I mean, it's interesting because this is what a lot of artists are worried about. This is kind of intellectual property. Like if I feed something into it, so say it gives me an answer and it's not really all the way accurate, and me as an expert, I like fill it in and I fix it. Like now does that AI know like my intellectual property? And that's a good question. That's why the New York Times is suing OpenAI. It's why people care about that. In the grand scheme of things, like you or I or your mentor, the amount of data that we're going to put in it versus like New York Times is just like so small. It's probably not going to move the model one way or the other. So for us, it probably doesn't matter if we put things in there that we think not very many people know besides ourselves.
Yeah, no, I think that's great. Where do you like envision the healthcare like landscape in the like next, let's say 10 years? With the integration of AI. I like, and it's crazy to think that because I just think about 2 years ago and like the last 2 years of like really open evidence and AI and freed AI and BARD and all those things. Like, wow, how much it's helped me streamline processes, automate things, formulate a thought, like taking all the notes I did at like on a conference. And I'm like, oh, now I have Otter. So now it's just going to take the notes for me and transcribe it. And great. Now I'm going to create like a nice, Cliff Notes version of it for my staff. So where do you see this going in 10 years?
10 years is a long time, honestly. I mean, like you said, 2 years ago, most of these things didn't even exist. And so where are we going to be in 10 years? So I think of it as on the patient side and on the doctor side. Like the patient side, I think you should have a personal AI that's thinking about your health and guiding you as much as you want to be guided. Some people are going to say, I'm going to go binge drinking tonight. I don't care what my AI friend tells me. But those people who want to optimize their health, they should have an AI guiding them and helping them as much as possible. On the physician side, you should also have like this AI co-pilot that's kind of offloaded all your tasks and helping you take care of your patients as much as possible. I think it's going to be really interesting to watch. I think that good clinicians are going to be more valuable than ever. And clinicians that are not great, I do think there is a risk of AI replacing clinicians who aren't great. Like as the AI gets better, and the AI is just as accurate as a clinician who doesn't really make eye contact and doesn't really want to be there, then I think there is a possibility that patients are like, you know what, I'm going to use this little AI thing instead of a clinician.
Yeah, it's going to be like an office of kiosks, right? Like you're going to go to the kiosk, you're going to check in, it's going to like scan your eye, all your data is going to come up. It's like crazy stuff. I don't know. It's like I said, 2 years ago, like just in the last 2 years and the amount of AI, like, and it's like the more you use of it and the better you understand it, like the more efficient you are as a practitioner to use it in running a business and creating an SOPs, tracking your inventory, doing calculations, like all these things. It's incredible. It's so incredible. Or even to make predictions based on this pattern, like what would your prediction be? Which is so great. So great. Do you have any advice that you would give to any of the providers who are maybe skeptical about adopting this new technology?
I mean, a couple things. One, just use it. And two, actually be willing to even pay for versions that are better. Like Claude Opus is a really cool model that is better at writing than GPT-4. Like I think it writes much nicer. So I would say be willing to pay a few dollars a month to like upgrade and try. One of my favorite tools is called Poe.com, P-O-E. And that's because they give you access to like all these different models. You can have GPT-4 and Opus and all these different models, and you can play with them and see what they're like. But But that's kind of what I'd say is like, don't be afraid. Don't just stand back and watch the future kind of make decisions for you. I think clinicians as a whole, we have like, we're where we're at because clinicians haven't always been engaged. Like healthcare, typical traditional healthcare kind of sucks because clinicians didn't throw a big enough fit and say, hey, we shouldn't do those things. And so like, let's not let that happen again. Because right now, if you look at how insurance companies use AI, they're way more efficient than we are. And we can't let that happen again. We can't let like the administrative layer of healthcare overtake the clinical layer, which is the really important layer.
Absolutely. Absolutely. Well, I think this was so great. I hope so many practitioners find this fascinating as much. I was like taking notes while you were talking. I'm like, I'm going to look that one up. So where can people find you? Are you on social media, YouTube, LinkedIn? Where are all those places?
Yeah, I mean, most of my stuff sits underneath Bionic Health. So LinkedIn is where my personal kind of network is the strongest. So you can find me, connect with me on LinkedIn. And I'm pretty happy to connect with anybody unless they're trying to sell me stuff all the time. And then on social networks, YouTube, Bionic Health, and Instagram.
Perfect. Well, thank you so much. I so appreciate you taking the time to get on this episode for a topic that I think practitioners really need to be aware of to help better their practice and not only that, make things more efficient in general. So thank you so much.
Awesome. Thanks, Lexi.